Hello, this video is being brought to you by the Essex Sexual Health Service. This video is part of a series that we've made for parents and carers concerning topics of RSHE, that is relationships, sex and health education, with tips and ideas on how you might engage with your young person around these topics. This video has been created for parents and carers of young people with SEND considerations, that is, special educational needs and disabilities. The term SEND covers a wide spectrum of disabilities, so some of this advice may be more or less relevant to you, depending on your child's needs. RSHE topics should be covered in your child's school, but it's important that messages are reinforced at home. You can ask your child's school to view their RSHE policy and curriculum at any time. Young people with disabilities are often discounted from conversations around sex, sexuality, and relationships. But having a disability or an additional need doesn't stop you from being a person who may have sexual interests and who does have sexual rights. Your child may have a learning disability that means their learning age is lower than that of other children their age, but they may have hormonal and sexual development at a standard rate. Children benefit from understanding what is happening to their bodies so they can feel comfortable, explore safely, and make choices about what they might want when it comes to relationships, and stay safe from potential abuse. When young people are excluded from narratives around sex, or when sex education is insufficient, incomplete, or non-applicable, they have higher risks of negative sexual experiences, contracting sexually transmitted infections, or having unwanted pregnancies. We recommend talking to your child about changes of puberty before they occur, so that they can grow accustomed to the ideas. We recommend having a series of small, short conversations that are repeated often, so your child has time to process any new information and can come up with questions if they have any. These changes might include things like changes in their skin, voice, height, hair growth, and maybe their mood. Try to be clear about these things that might occur. Try avoid using metaphors like a voice breaking, as it may be confusing or cause alarm to your child who may take things more literally. You can let your child know that all these changes are normal and will happen to everyone, although potentially at different times. Often these changes can be more difficult for a child with SEND considerations. For example, menstruation or periods can be particularly challenging for young people with sensory difficulties. Explaining clearly what will happen before they get their first period can be key. Introduce them to different products so they're used to the idea of them. For some children, using alternative products such as period underwear can help with sensory issues that might arise from pads. But it's okay to buy, show, and try different things out, and listen to your child about what they prefer. It may even be appropriate to talk to your doctor about contraceptive options that can help regulate or suppress menstruation. You might use storyboards to break down the process of something like changing and disposing of a pad. Try to encourage independence around skills like this and other bathroom tasks, as it can help protect your child by reducing their interactions with others around their intimate areas. Try to use medically accurate terms for body parts, such as penis, vulva, or vagina, as well as using clear language that your child will understand. Using euphemisms for body parts, as well as for things like slept with rather than had sex with, can be confusing for young people. Additionally, it means that if sexual abuse were to occur, which sadly does happen at higher rates for those with disabilities, your child will be equipped with the language that they need to identify and report any unwanted behaviour, and it will be clear for those who they might report to what is going on. You can help your child to define the boundaries between public and private. This can be in relation to their bodies or in relation to actions or spaces. The NSPCC's PANTS rule can be useful for teaching your child about the private parts of their bodies, where you find a link just below. It can also be good to teach your child about behaviours and actions that are appropriate in public versus in private by using specific examples. When discussing private and public spaces, it's important to be very clear, and you can even take your young person to these different locations and ask them to categorize them. For example, a bathroom at home might be a private place, but a bathroom at school might not be. Your child needs to know what topics might be classed as private or public, and who they can talk to about private topics. For examples, their bodies can be discussed with you, maybe a doctor or a school nurse, but in private spaces. Try and talk to your young person about touch. You can lead by example by asking before you touch your child, for example, when you're even giving them a hug, and encourage them to do the same for others. For essential touches, you can narrate your actions and explain exactly what you're going to do and why you're going to do it. For example, I'm helping you get dressed so we can be ready for the day and go out. This teaches young people that communication and consent should always be a part of touch, and they can make choices about their own bodies. You can practice with your young person saying no to touches, and you can try and explain types of touches and how some touch might be unsafe, such as hitting or kicking, but also sexual touching when it's unwanted from someone who shouldn't be doing it. Sexual touches might feel good, but they can still be unsafe if they're unwanted or from someone who they shouldn't be having them from, or they're in a public space. Masturbation is something that many young people will experiment with, but again, they need to understand the appropriateness of when and where it may be safe to do. They need to not be shamed, but know where the boundaries are applicable. Additionally, young people need to know about safety of their genitals. Tugging or rubbing too hard can cause damage to their skin or bodies, and that many objects are unsafe to be using for genital stimulation or insertion. If you have a child that's interested in sexual activity with others, they need to know that firstly, the age of consent is 16 years old. It's essential that they get consent, but that their capacity might be affected by their disability. And if they're having sex with another person with a disability, it might affect theirs. How this might affect power dynamics in this relationship, which might affect their ability to freely say yes or no. Helping your young person spot the signs of a healthy relationship can aid in their understanding and know when sex might be appropriate. Looking at things like healthy and unhealthy behaviors in a relationship, or different ways to show affection to other people. We also use tools such as relationship timelines, where we ask young people to sort different actions, such as these above, in order to what they feel is important in their relationships. Breakups can be particularly difficult for young people, and particularly hard for young people with SEND considerations. Talking to your young person about breakups, how they can happen for lots of reasons, and how they can happen to lots of people. You will be there for them if they do happen. And telling them all this before the young person enters into a relationship can help prepare them. You can use role play or social stories to discuss how consent might look and be affected. Your child should know that they can say no to any touches that they want or to sex at any time, and they can change their mind about it. For a full exploration on consent, please check out our video. Your young person needs to know there are lots of reasons why someone might choose not to consent. They might not feel like it. They might just not be interested in sex. They might not want that type of relationship with you. If you're in a relationship and someone chooses not to consent, it's not necessarily a rejection of you. They're just letting you know their boundaries. Legally, mental capacity around consent requires both parties to understand the mechanics of the act, as well as the risks of pregnancy and sexually transmitted infection. So it can be important to check in with your child to gauge their level of understanding of what sex means and the different reasons someone might be having it. If your child is thinking about sex, they need to understand the importance of things like contraception and condom use. Your child may be interested in the idea of having a sexual relationship and needs support in accessing things like contraception or sexual health testing or talking to a doctor. It's good for them to know that they have your support and they have the option of having a sexual relationship if they choose to do so and if it's age appropriate. Please view our services video to have a look at what services your young person might be able to access. Using social stories to explain things like sexual health testing can also be useful. Some people might not like the idea of sex, or even kissing or touching, and that's fine too. You can reassure them that they'll only ever have to do what they are comfortable with. They may be still interested in a romantic relationship, but just not the physical side, which can also be possible for them to have. A young person might ask you a question or use a term that you're unfamiliar with. That's okay. You might have to tell them that you need to go and do some research of your own, or even use this opportunity to show them how they can safely use the internet to find information about RSHE, showing them safe websites, or showing them how to put NHS in all searches around anything medical, or even finding easy read resources. Internet safety is important for all young people, and if your child has access to the internet, it's important they know about how to keep their privacy and what to share. If they see anything upsetting, that they can come to you. Even with parental filters, young people will often encounter pornography on the internet and from a young age, although often accidentally. They need to know that while it's okay to be curious about sex, what they see is not necessarily real, and it can show things that are inappropriate for them to be watching or even show something unsafe. CEOP, the Child Exploitation and Online Protection, have a great website about broader internet safety, with sections for parents and games for young people around staying safe online. You can reassure them that you'll support them if something goes wrong or if they make a mistake. For many young people, threats, such as taking away someone's phone, means that young people won't disclose if they've made a mistake or seen something that they don't understand or has upset them, because they're afraid of the consequence. Please do explore our video on technology for more information around this topic. For all of these conversations, it can be best to have short, clear talks and have a little and often approach, so that your child has time to process any new information, time to formulate any questions, and any new ideas that you introduce can be reinforced. You can use examples from TV or that you see in real life to try and help facilitate these conversations. So if, for example, a relative is pregnant, it can help start these conversations. There are some great resources out there for you and your child, and we encourage you to explore some of these for yourself, as listed on the next slide. You can also always ask your child's school or your local sexual health team for more support or information. Thank you very much for watching. For local support services in Essex, please see this list.